Hi, my name is Kayla Griffith and this is my presentation on gerontology. Gerontology is the study of aging in older adults. The science of gerontology has evolved as longevity has improved. Research in this field are diverse and are trained in areas such as physiology, social science, psychology, public health, and policy. Many people confuse gerontology and geriatrics. Gerontology is multidisciplinary, studies aging across the lifespan, deals with physical, mental, and social implications of aging, and may be in specialties such as social workers, architects, nursing, home administrations, life coaches, and directors of nonprofit organizations. Geriatrics is a medical specialty that focuses on diseases of the elderly. It deals with patient care and treatment of older adults, and they are most typically MDs, or medical doctors. And now I will discuss different health issues that elderly people face. One of them is Alzheimer's disease. Alzheimer's disease is the result of neurons starting to die off, specifically in the hippocampus. The hippocampus is the part of the brain that is responsible for forming memories, which is why Alzheimer's patients start to lose their memory. An estimated 5.2 million people of the age 65 and older have this disease. 1 in 3 seniors die as a result from Alzheimer's or some other form of dementia, and is ranked 6th for cause of death for older adults. Depression is a medical condition that affects a person's ability to function normally in daily life. It is not a normal part of aging. There's many types. Late life depression affects about 6 million Americans ages 65 and older, and less than 10% receive treatment for it. There's many risk factors, such as having a chronic medical illness such as cancer or AIDS, having a disability, being socially isolated, taking certain medications, or experiencing a traumatic event such as losing someone close to you. Heart disease is a disorder of the blood vessels of the heart that can lead to a heart attack. A heart attack happens when an artery becomes blocked, preventing oxygen and nutrients from getting to the heart. Age greatly impacts the cardiovascular system. Some problems that may occur are the SI node, also known as the pacemaker of the heart, may lose some of its cells, blood volume can decrease, reduced speed in production of red blood cells, and neutrophils, which are part of the immune system, may decrease in number. Some statistics are an estimated 83.6 million American adults have one or more types of cardiovascular disease, and heart disease is the leading cause of death for both men and women. Suicide. In 2014, the highest suicide rate, which was 19.3%, was among people 85 years or older. The second highest rate was for the age groups between 45 and 64, which is 19.2%. White males have a higher rate of suicide. Some warning signs would be isolation, depression, experiencing a personal loss, lack of personal safety, or loading up on medications or other lethal objects. Here's a graph that illustrates the 2011 suicide rates across the lifespan. We see that males have a higher significant suicide rate than females, and the highest rate builds from age 70 and is at the very, very highest from the ages 85 and higher. Arthritis is used commonly to refer to inflammation of the joints. It can affect one joint or multiple joints. There are more than 100 different types of arthritis. Arthritis is caused by the damage to the cartilage surrounding one's joints. Damage can occur due to normal wear and tear, also known as osteoarthritis, infection or injury, or an autoimmune disorder, also known as rheumatoid arthritis. Almost half of adults over the age of 65 have some form of arthritis. Arthritis is the nation's #1 cause of disability. It has a great impact. It may cause people to lose more work days and even lose their jobs. Depending on where the person has arthritis, they may have difficulty doing simple tasks such as standing, walking, or even simple movements of the hand, and it may cause older adults to lose their ability to live alone. Falls. Each year, more than 1.6 million older U.S. adults go to the emergency department for fall-related injuries, hip fractures being the most serious type of fall injury, and this is because it may cause extended hospital stay or require permanent long-term care. And this causes many adults to be fearful of falling, so they may avoid going out or even avoid basic activities such as climbing stairs or walking. Thank you for watching my presentation. If you have any questions or comments, feel free to email me at griffithkayla01@gmail.com. Thank you.